strategies, the pandemic in Brazil. The speakers will discuss conflicts and responses to the COVID-19 pandemic at the municipal, state, and national levels of government. They will discuss perceptions of risk with regards to the pandemic and the diverse approaches to it, with a focus on the political and health-related implications of widespread uncertainty. Our presenters will speak for approximately 15 minutes each, followed by comments by the chair. They will then briefly respond before we open for questions from the audience. Our interpreters, Iris and Karine, will be providing simultaneous interpretation from English to Portuguese and vice versa. So if you wish to change the language of your audio, just click on the globe at the bottom of your screen. I now have the great pleasure to present Dr. Anna Petherick, who will be chairing this session. Anna Petherick is co-PI of the Oxford COVID-19 Government Response Tracker project developed at the Blavatnik School of Government, where she is departmental lecturer and leads the Brazil Subnational Tracker project. Anna, thank you so much for being with us today. The floor is yours.
Thank you very much, Katerina. And just to say that I am hugely honoured to be part of this event, not just because I have been lucky enough to collaborate with half of the panel on different pieces of COVID research, but primarily because of the sheer importance of the topic. Now, obviously, COVID is one of the most important and all-encompassing experiences of all of our lives. And certainly, I think discussing COVID in the context of Brazil is particularly important as someone who is running a global project. For the tracker, we actually have several subnational projects, but the first one we started was Brazil. The reason for this was there was a sense from the very start that the conditions were poor for Brazil to do well at managing this problem. It's a large federal country, decentralized with very complex patterns of legal competencies in different policy areas that were going to be relevant to managing COVID. And then adding to that huge inequality and a politically polarized country with a president who is both anti-science and anti-big government, which are two things you really need to be pro in order to manage COVID well. So I am very, very excited to hear what our distinguished panel have to say on this topic. I will welcome each of the panel in more detail and tell you more about them as we introduce each of them for their 15-minute presentations. But just to say, Andreza, Lorena, Elaine, and Eduardo, I am a huge admirer of all that you do. You each have 15 minutes, as Katerina just said, and I will put a little warning in a private message to you so you know when your time is almost up. We're going to start with Andreza, who, as you know, is one of the organizers of this series of discussions. And Andreza, as well as being a wonderful friend of mine, is director of the Brazilian Studies Program and course director at the Latin America Center here in the University of Oxford. She teaches on politics and cities in Brazil and Latin America. And her research, which is fascinating, I love hearing about behind the scenes all the time, includes things like participatory politics, inequalities, and in particular, she's interested in local governments. And during COVID, and actually slightly pre-COVID, she has been working with a now quite famous group, to those of us following Brazil, called CADI. And I'm going to hand over to her, I think, to talk about some issues to do with grassroots mobilization and inequality in Brazil. Over to you, Andreza.
Thank you very much, Anna, for the introduction. I'm going to try to share my screen. Just a second. I'm actually think having some problems to find my PowerPoint. I don't think I can share my screen right now, but I sent my PowerPoint to Ivan as I was having problems before, so I think he's gonna start my PowerPoint for me. And I'd like to highlight how amazing it is to be here with all of you and to share some of this ongoing research on COVID-19. As Anna just said, a lot of my work is with co-authors from the CADI Center, and as well as I'm going to share some reflections of the work I had with the pleasure to do with Anna. And when I was thinking about what to speak today, one thing that came to mind is that with a total of 450,000 deaths in Brazil and this uncontrolled pandemic, we obviously think much more often on what was not done. And we not always can focus on what has been done in Brazil. And a lot of people put a lot of sacrifice to really manage the pandemic in the country. And I think it's important to recognize some of the actions that were taken, as well as some of the challenges that were faced. So I have my slides. Ivan, if you could maybe make the slides full screen so that people can see them better. I will try myself to share my screen. Let's see if this way it goes. I'm sorry about that. I was having this problem before. Okay, I think you can see. I think I can try to share it myself, Ivan. Otherwise, I don't think this is going to work. Can you see now? I think now it works, right?
Yes.
Okay, thank you so much. So I was having this problem already before, I don't know why. So what I want to highlight is that we actually had a lot of responses to the pandemic, even though we like to emphasize that we had a lot of problems in the response. We did have, when we think about that, a range of measures to stop the pandemic very early on from states and from local governments too. And just to think that when we think about the NPIs, which is these non-pharmaceutical interventions, we need to understand that local governments actually closed most of their non-essential services, like put restrictions on transportation or closed the schools or reduce the number of public transport, etc. On an average, 50 days before they had the first confirmed case of COVID-19 in their city. And even in cities that had these actions taken after the first case, usually the delay was 2 days. So the mean of acting after the first case was confirmed was only 2 days. So there was actually a lot of actions that were taken before the first case of COVID appeared in the majority of the municipalities. And there was quite comprehensive uptake of those actions. So if we see here in this bar, what this bar shows is that the number of municipalities that closed non-essential services, you can see that the majority really closed in between the 27th of February and the 27th of March, this with an uptake in the middle of March. But what we can also see is that the number of cases of COVID-19 kept increasing. So when we think that in early March, when we had like 5% of the cities with confirmed cases, but then when we get to the end of May, we have 75% of the municipalities with confirmed cases. And this, of course, creates an impact on the credibility of social distancing measures, because if all these measures were taken, why would COVID still spread? And we know for sure that social distancing is connected with fewer and delayed cases of COVID-19. What is a problem then is this lack of a national coordination, and that is associated with disease spread and also resurgence of cases. So although we can see that measures were taken, were adopted across Brazil, and they were adopted earlier on, there was a lack of coordination nationally, and it was a president, as Anna said, that was in many ways aggravating the pandemic. So this figure shows a little bit how a lot of the actions like sanitary cordons, which were not very popular, but social isolation, transportation, they happen like pretty much in March, restriction of agglomerations and so on. But the flexibilization of measures, then it doesn't really, it doesn't follow the pattern of being very organized. And we can see here in Minas Gerais, this is a map that shows the different colors, means the different dates when municipalities, the different months when municipalities decide to flexibilize distancing measures. So we can see that there were growing conflicts on whether people should stay home or not, on the very seriousness of the virus. Mobility started to rise very earlier on after social isolation, so it didn't last much, this idea of staying home. And many towns decided to flexibilize, as we can see in the map. And even though people travel across cities, many times just for work, back and forth, we can see that cities were not really coordinating their measures. And this was, of course, an enormous problem on understanding the importance of social isolation and being informed about it and really seeing results in Brazil. But that is not the only difficulty that Brazil faced. Inequality and informality in Brazil, they are very strong in the country, and they made staying home nearly impossible. And this is just one of my last slides, and then I'll talk more freely from then on. But what I want to show here is that when we look at at São Paulo, we can see that the poorest 40% of the people, they had 80% higher risk of hospitalization. And they were 60% more likely to die from COVID-19, while Black individuals were 37% more likely to be hospitalized. Pardo or mixed Brazilians were 21% more likely to be hospitalized. Those groups were also more likely to die from COVID-19 in relation to white individuals. And patients that were in public hospitals, they were 40% more likely to die from COVID-19. So this already shows that inequality is a problem, and it's a problem that was there before the pandemic. And this is a problem that also aggravated, obviously, the pandemic. We can see in this graph, this is the blue line is white population, the black line, the red line is Black. And then you can see this is levels of isolation. And then you can see that Black people in Brazil have more problems to socially isolate and also to retain this level of isolation. The same happens with lower income groups. They take longer to start isolating, and they cannot socially isolate as much as high income groups. So it's not surprising that we see these individuals in wealthier neighborhoods that are predominantly white, that were the ones to isolate to a greater extent, and they also could socially isolate earlier than the other ones, and they could isolate for a longer period of time. And when we think about Brazil in general, we can also see that the places where COVID started, it's not necessarily the place where COVID thrived, and COVID-19 really soon became the focus of outbreaks shifted to north regions of the country that are also regions that are poorer. So when we think about the burden of inequality for COVID-19 in Brazil, what we see is really that the groups that are poorer and are also groups where the state's more absent, were also the ones that contradictorily had to have a stronger action. It's the contradiction and the great point to emphasize in this presentation is that those people who were most affected were also the same people that had to act to mitigate the crisis. And this is what I want to say. I'm just going to check here whether I still have some minutes with Anna. Is it okay? I had some problems in the beginning, so I'm a bit lost with time. But what we can see here is that in places where the state is absent, in these places where that were mostly affected by the pandemic, is also the places where communities took actions to mitigate the crisis. And it's not rare that we think about this insurgent citizenship in Brazil, that we really look at how communities act and how this action is very much related to the absence of the state and to poverty and to the lack of service provision. What is less discussed is that grassroots mobilization tends also to increase when economics increase, and it's very difficult to mobilize in times of economic decay. And that's something that I want to talk about. So the combination of economic growth and empowerment of these non-state groups is not always available in the social science literature, because we tend to focus on how groups mobilize to improve public transportation, to improve access to housing, to improve access to health services and everything. However, the idea that poverty also impacts on political capacity to mobilize and to sustain mobilization should also be discussed. So if we have a grievance agenda, which is often the lack of public services that pushes people into mobilization, that mobilization to be maintained will also depend on economic resources. So a grievance agenda is not enough always to create mobilization. It's not always enough to sustain mobilization. So it's usually a combination of motivation, but also capacity that can sustain this kind of mobilization. And we saw during the pandemic in Brazil that obviously you have motivation. You have people who have to self-isolate. We need to understand that auxílio emergencial was not being paid from the very start, from social isolation. It took some months until it started being paid, and people had problems to have access to it. So you have people who have to socially isolate, but these people need resources. And then communities mobilize to facilitate that, to make information available, to facilitate contact and tracing through WhatsApp groups, to disseminate support against violence against women, which was a real problem in the beginning of the pandemic, but throughout with social isolation, we saw an increase in violence actions. So all these actions to help people to mobilize, but how do you maintain that? And how can we guarantee that societies and groups that are most vulnerable and that need those support the most also have leaders, community leaders from the beginning? So we know that in many places, these leaderships were already there, but in many other places to create that leadership was very difficult. So looking a little bit at the idea of race and gender, when we think about mobilization from below and community activism, we know that a lot of those community leaders will be women. And women are usually leaders of community neighborhood activism, because they are in this great intersection between public and private sphere. It's usually women who have different responsibilities, and therefore they adopt different routes in the city, and they may be more affected by lack of transportation, by lack of provision in nurseries, and of course issues of personal security also affects women the most, and therefore women take stronger activism, not by virtue of their privileged position, but actually by being victims of a city that doesn't work very well. And then women tend to be community leaders, and especially in communities that are underprivileged and that are vulnerable, then we know racially those are Black women. And Black women in positions of leadership were also overburdened because of the pandemic. They were carers, and they were taking care of their own families as well as the family of others. So we have a situation in the pandemic in Brazil where we rely very much on this activism from below to sustain people to stay home, but this activism from below is obviously harmed by the pandemic itself. As I mentioned in the beginning, people are more likely to die, more severely affected. And at the same time, they are the leaders that have to engage so that the communities can work. So to really support these leaderships over a long pandemic that is lasting more than a year is extremely important. Donations have diminished as we continuing the pandemic and have made this activism even more difficult. But community leaders, as well as municipal governments, they're not alone in some of the actions that were taken to diminish the pandemic. And just to finish, I want to highlight another group that has done a lot, which is the community of scientists themselves, who have created a lot of data sets and have shared information. And with that, there is also a number of public servants that have done their best to keep data available and to really keep information its best. But for many people in this group, intimidation has also been a very big problem during this administration. And we started this conference with a panel with Ricardo Galvão. And Ricardo Galvão, it was very interesting because when we had in 2019, the increase in fires in the Amazon, Ricardo Galvão, who was the president of INPE, he was fired after he released the annual report. And then we have at that very moment this idea of the strong intimidation when doing one job can actually threaten one person's job. And that's what we discussed here in panel 1. And we have seen continuous abuse in social media and threats, and the feeling of uncertainty and the use of information that is being produced that is being very politicized and very and create a lot of contradictions and offenses to the community of scientists and public servants. So to really finish this panel, I want to highlight that even though we have 450,000 deaths in Brazil, there is a group of people that have been acting to diminish that, often facing the burden of the pandemic themselves in an infection way, but also in a political and very conflicting situation that is happening in Brazil. So we need to look at this group a little bit more and really see what we can do to support those who have been fighting against those horrifying numbers that we are seeing in Brazil. Thank you very much.
Thank you, Andreza. As hard as the numbers are and the experience of staying safe is for everybody, I think it's really encouraging to focus on some of the positives. And I might actually take a moment to thank you for some of your courage, because I know that you've had some difficult moments as well, where you've been trying to relay the truth in the media. And on that note, I'm going to turn to Lorena Barberia, who I know has also a great deal of courage in communicating on COVID with policymakers and with the media, because I've had those discussions with her behind the scenes over the course of the past year. Lorena is probably well known to many people viewing. She is professor in the Department of Political Science at the University of Sao Paulo. She's a principal researcher at the Center for Comparative and International Studies and at the Center for Studies in Politics and Economics in the public sector of the Getúlio Vargas Foundation in Sao Paulo. The list in Lorena's bio is very long, of impressive institutions and publications. So I will stop there and hand over to her for her presentation.
Thank you, Ana. Thank you, Andreza, also, and thank you to everyone for inviting me, and congratulations. I've been following the series, and it's been really interesting, and I've learned a great deal from the sessions. And in the spirit of, I'm hoping everyone's able to see my screen and able to see it in presentation mode. In the spirit of trying to help, no, it looks like it's the day. So Andreza, you're not alone. Now my slides, I'm also not able to show them in presentation mode.
I can see them, but yeah,
yes?
not in presentation mode.
Yes, for some reason, I'm sorry. Okay, hopefully now it's okay. Okay, yes. So in the spirit of trying to kind of recap we're at a moment, I think, where we're reflecting in this conference, and a lot of the presentations I've heard, it's a moment of trying to recap and reassess where we are. And what I'm going to try to do is first, as Andreza and Anna already mentioned, just call attention not only to the striking amount of deaths from COVID that are officially acknowledged, and this is just showing the speed and the amount of deaths across the pandemic since the first death to reaching the hallmark of 450,000 deaths very shortly on May 25th, but to also to call your attention to the fact that across time, the speed of reaching each of those milestones is diminishing in the amount of days. So in a shorter amount of time, more and more deaths are, we have more and more deaths accumulating. And on the bottom, you'll notice that what I put is SARS associated deaths. So if we look in the same day and we think about the fact that there's several deaths that we suspect are due to COVID, but due to lack of testing and lack of confirmation at the level of at the time of the death occurrence, the amount of deaths is even higher than the milestones that are already shocking and indicative of a very tragic situation in Brazil. And with also the idea that we're not really clear towards where and when we will see deaths and cases, the number of cases start to fall. So why is Brazil, the response in Brazil, why could it have been different? I think it's been stressed in a couple of the sessions, an extensive primary care system within a unified public health system in a developing country was certainly a strength, community health workers, long-standing experience in national immunization program. There was already 38,000 immunization rooms ready for when vaccines were ready. The health system very well organized at the macro and micro level. Capabilities for vaccine development and production, a national surveillance system and infrastructure and data collection systems, and also the experience on past health academics, thinking about HIV/AIDS and Zika. But some of the factors, as Anna was saying in her opening comments, also signal that we were from the outset, we're going to have a very difficult situation in Brazil. Inequality, poverty, and large informal workforce, a continentally sized country, a federation with 26 states, a federal district, over 5,500 municipalities. And we also had a president with no past experience in government as an executive coordinating a public administration, and in less than a year in power at the time that COVID starts to hit. We had underinvestment in science and technology and deindustrialization occurring, environmental degradation occurring, and this is important because we know that COVID is a respiratory illness. It's important, and there's links between climate and environmental degradation and the severity of the epidemic in certain regions of Brazil. And we had a lot of signs of increasing political polarization, and social media playing an important role in polarizing or in making visible those debates. So we're at the point, we're at a milestone, we're over 450,000 deaths. Why should we still be worried about the COVID response in Brazil? Because we don't have active genomic surveillance programs that are widely spread and gathering data consistently. So we have several variants of concern, some of which are homegrown and some of which are being imported because we have insufficient screening of travelers. Testing of active cases continues to be below targets. Most states, as I'm going to show really quickly, continue to adopt programs to loosen non-pharmaceutical interventions far in advance of when containment exists. We have a failure of coordination across all branches of the federal government. So we have conflicts between the Ministry of Health and the Ministry of Economy on even when we agree that certain expenses and certain priorities should be made, they're not in fact approved or actually executed. We also have, as Andreza was speaking, the problem with emergency cash transfer programs that for the most vulnerable were never articulated to really encourage those individuals to stay at home, and those programs to be increasingly cut across time. Remote education programs, which were poorly structured and inadequately delivered, and public education funding being cut in the year of the pandemic, which leaving schools very vulnerable for entering 2021. And vaccination slow and still very little monitoring of how infections are going in those who are receiving vaccines. So there's a lot of reasons for us to be concerned about where Brazil is in this moment. And it becomes clear to us also across time, and there's a long literature, and several of us in this table have been contributing to research to try to make clear that the federal government lacked in clarity, lacked in coordination, and lacked in coherence of its policies. So Brazil failed to control borders and quarantine travelers. It failed in terms of essential services, when at a time where we were trying to really signal that we needed to prioritize and control what services were being allowed to operate. Essential services were being expanded at the federal level in Brazil. Mask mandates were being vetoed, which had been passed by Congress. We had incredible turnover in terms of the actual running of the health system, with the health ministers resigning. And the majority of initial investments were towards hospitalization and ICU beds, and not towards testing programs that detected active cases. So even when we look at testing investments, we see that the amount of testing was equally divided between seroprevalence studies and the types of testing such as PCR tests that would detect active transmission. And there was delayed investments in vaccines. And this is really important to underscore, because given the scarcity that we knew that would occur in 2021 in terms of vaccine supply, most countries undertook a diversified portfolio of investments in vaccines, and Brazil concentrated its portfolio in one vaccine at the federal level. But at the state level, there was important initiatives that were undertaken. And one of the first states that we want to talk about, and I just want to show this really quickly to illustrate part of what is important to understand about the fragmented response, is the response in the state of São Paulo to developing and securing an agreement with a foreign manufacturer of vaccines, Sinovac, in which the state of São Paulo, through the Butantan Institute, which has a long history of vaccine production in Brazil, made an agreement to develop, first to undertake the clinical trial of the vaccine in Brazil, and as well as undertaking the clinical trial, made an agreement through technology transfer, to then bring the vaccine first as a manufactured and imported vaccine, and then eventually a homegrown, locally produced vaccine. So what happened at the federal level when we observed that the state of São Paulo undertook this strategy? I'm going to show you very briefly is that actually what we have is a lot of evidence now that the administration influenced adhesion to the vaccine trial, influence in vaccine hesitancy, and actually is also influencing in the securing of vaccines arriving in Brazil. So this is just showing social media and showing a little bit about what's happening across time with the flow of social media on CoronaVac, which is the name of the vaccine. And what I want to call your attention to is the clinical trial is undertaking place in the second semester. And as the clinical trial is taking place in Brazil, this is a moment when the CoronaVac posts against the CoronaVac start to increase. And this is important to understand, because we all know that the speed in which you finish a clinical trial means that it helps to bring the vaccine to approval, eventual approval and distribution in the country. So one of the striking things that happens is that when we actually look at the Twitter posts and divide at the time of the clinical trial, and we look at pro-vaccine Twitter posts, tweets, and anti-vaccine Twitters, what you can see is that in select weeks that I'm showing you here, just to call attention to, and this is part of a policy briefing that we've prepared, you see that there's a dominance in anti-coronavac tweets on Twitter that we start to map across time, and we start to track this activity. And what's interesting and also troubling about this activity that we track is that we detect that the Twitter activity is motivated and being generated by many people, many individuals, which are either very active in social media, but also individuals who hold posts as publicly elected congressmen and deputies in Congress. So there's an active campaign in social media to question the efficacy of the vaccine, to question the origin of the vaccine, and to call for opposition to using the vaccine. And this is just, this is just really quick slides just to show you we have data, and we've analyzed this very carefully to show you what's going on. And this coincides with periods in which also there's presidential references to the vaccine and denunciations and trying to discourage individuals from this specific vaccine. And so what happens to the population in polling is that in the same moment when we see an increase in social media against the vaccine, this is when we see a decrease in vaccine or an increase in vaccine hesitancy in the Brazilian population, which is really remarkable if we think about the context that Brazil is a very highly used to population of participating in vaccination programs. And what does that result? It results in a geopolitical conflict with China. We have documented that that means about 10.5 million doses of the active pharmaceutical agreements failed to arrive in Brazil, failed to leave China during a really critical stage. And that results in a failure or in a deficit of 12 million doses that currently could be being used in Brazil, but aren't available because of the difficulties and the bureaucratic delays there have been between China and Brazil in getting these vaccines in the country. The last thing, just to end, because I think I'm not sure, Anna, how much time I have.
3 minutes.
Okay, is to just turn quickly to the issue of, so we've looked at the federal level, and I've tried to give an example of this is not only a failure to coordinate, but there's actually instances in which the federal government has been very active in trying to interfere with states who attempted to organize a stronger response to the pandemic. But when we look at the subnational level, and we look at right now, this is a study that we're currently undertaking. We've been mapping what are the criteria that are used by subnational governments to loosen social distancing restrictions. And what this shows, and what I hope this underscores, is the fragmentation that we see in terms of how each state is responding. So the bubble, the number, is the number of states that use this criteria. So track this as an indicator and use this indicator to assess risk level, and to depending on how the risk level is showing, increase the level of non-pharmaceutical interventions or decrease and loosen them. And so what you can see is there's a lot of heterogeneity, but at most, what are the most prominent indicators that we have, which states prioritize to loosen social distancing? Hospital beds and number of cases, followed by deaths. But the number of what we know from the outset of COVID, and what we know from the outset of what's working, is surveillance. And few states use surveillance indicators to monitor risk and to use them to assess how risky it is to loosen social distancing policy. So this is kind of at the same time as what Andreza is saying. Thank goodness we have states mobilizing. Thank goodness that we have states trying to do better and trying to protect the population. At the same time, each state is adopting different criteria and making policies on their own. And this is very inefficient, but also it's also reflecting a larger problem in Brazil, that we continue to manage COVID by the number of beds, which is the last solution, not the first. And if we look at how these policies apply across areas, we also see a lot of heterogeneity. So mostly these policies are targeted at businesses, but rarely, and businesses and parks and recreation, but rarely or more heterogeneous with regards to opening schools. And this is just showing where it's shaded in blue is if those criteria that I showed earlier are used for opening those specific areas. So there's a lot of heterogeneity in the subnational response. And I think this is an area that we've tried to do a lot of contributions. I know Anna has done a lot of work spearheading this at Oxford, Andreza as well. And we here on the ground, we're also trying to raise these issues. It's very challenging for these governments to do this. But another thing that I think is really important in closing to stress is that local governments and state governments, we're in the second year of the pandemic, have severe fiscal constraints and don't have the capacity nor the resources to sustain and mount the response to the humanitarian and sanitary crisis posed by COVID. So this is just a thank you. I want to thank all of my the team of researchers that work with me on this project. And I've also added some links to where you can find further information on the data that we used in this report. So thank you very much.
Thank you, Lorena, and I should thank your team as well, because your team has been coordinating with my team to code some of the policies that we see at the subnational level in Brazil. Okay, I'm going to turn to Elainey Nacimento, and I'm very, very much looking forward to her presentation. She has a PhD in sciences. She's a researcher in public health, assistant coordinator for Fiocruz-PI, and a permanent professor in the public policy program at the Federal University of POE. She's also leader of the Health, Intersectionality and Human Rights Research Directory and a coordinator for the Afro-Ibero Latin American Femicide Study Group. So it is my honor to hand things over to Elaine for her presentation.
Olá, muito boa tarde. A todas, a todos e a todos, né? Tentando aí ter uma linguagem não binária, enfim. Eu tenho tentei dar um título a essa fala de hoje, que é interseccionalidade como âncora de um barco chamado vida, né? Crise humanitária, sanitária da Covid-19. O que seria mais ou menos isso, né? Eu falo, então, do Brasil, que é um país que foi construído em cima de uma lógica e de uma realidade muito perversa e cruel, que é a escravidão. O que significa que pessoas foram sequestradas do continente africano, que é um continente que reúne 54 países com muitas histórias e culturas distintas. E nesse processo de escravidão, esse continente, né, esse país, que é um país continental, teve toda uma nação, uma cultura super rica, exterminada nesse processo, né? Eu estou falando dos povos originários ou indígenas. E o contexto que a gente está falando hoje dessa crise humanitária, dessa crise sanitária, é a Covid-19. E claro que é uma doença, uma pandemia que se apresenta não de forma democrática. Por que não de forma democrática? Uma vez que o primeiro óbito no Brasil, ele acontece em uma mulher negra, periférica, que foi contaminada, né, por seus empregadores, que chegam da Europa, que não adoeceram, e que hoje já tem uma outra empregada, uma mulher negra. Então, imagina que a interseccionalidade é uma forma de revelar uma face cruel do colonialismo, né? Que seria, então, todas formas de opressões estruturais, que seria o racismo cis-hétero-patriarcal capitalista. O que significa isso, né? É um conjunto de opressões que atravessam os mesmos corpos ao mesmo tempo. E aí, para isso, eu fiz um texto que é para nos nortear. É importante entender que as opressões, elas ocorrem na vida das pessoas, né? Mas algumas pessoas, elas não conseguem sair desta condição. Então, uma crise humanitária e sanitária como a Covid-19, ela não permite que as pessoas lutem contra ela, né? Elas se apresentam de forma dilaceradora para esses segmentos, para esses grupos, né? Então, eu preciso falar de algo que deu muito certo no Brasil e está sendo atacado de forma com muita crueldade, com muita força, que é o Sistema Único de Saúde, né? Que é o nosso SUS, que, inclusive, é a principal barreira para prever e dar conta e de salvar milhões de vidas, né, contra a Covid-19. Então, com mais de 30 anos de atuação, o Sistema Único de Saúde, SUS, fruto de lutas coletivas, é um direito de todos e dever do Estado. Tem em seus princípios a universalidade, a integralidade, equidade e participação da comunidade. Esteve presente de diversas formas na vida das brasileiras e dos brasileiros, seja na vacinação em massa, no serviço de urgência, nos cuidados básicos em postos de saúde ou nas visitas dos agentes comunitários de saúde em suas casas. Fruto de um investimento importante do Estado brasileiro, através da ciência, da pesquisa, da educação, de suas pesquisadoras, pesquisadores, de trabalhadoras e trabalhadores da saúde da sua população, a maior riqueza que o Brasil tem. O SUS atende, inclusive, a população que vive à margem da sociedade, os chamados invisíveis, através de políticas como consultórios de rua, que atende usuários de crack, ou população em situação de rua. Ou seja, o SUS atende todas as pessoas sem discriminação. Todavia, um sistema de saúde tão presente no nosso dia a dia, que teve inúmeros avanços, que tem servido de modelo para diferentes outros países, no entanto, nesse momento, enfrenta um conjunto de diversos desafios que colocam em risco a sua própria existência. O cumprimento de seu papel junto à sociedade como um todo, e em particular para mulheres e crianças negras. O SUS compõe o sistema de proteção social primário e básico para a população brasileira, que se encontra na base da pirâmide social. Mas ele vai além. Ele é um sistema de saúde de excelência em todos os níveis de atenção e, portanto, o segmento da população, né, considerado privilegiado, que tem plano de saúde, também acessa o SUS em seu mais alto nível de complexidade, pois ele é altamente resolutivo. Num cenário de crise humanitária, sanitária, fruto dos desdobramentos do colonialismo, que são os efeitos estruturais do racismo cis-heteropatriarcal capitalista, em que um pouco mais de 14 meses de pandemia atingimos a marca de mais de 440 mil óbitos para uma doença que já tem vacina. Mas trata-se de um Estado necropolítico que decide quem pode viver e quem deve morrer. Que está baseado em uma gestão que não tem nenhuma empatia com seu povo e, portanto, isso se traduz em uma ausência de planejamento e investimento de recursos em saúde pública, educação, ciência e tecnologia, cadeia de comando para executar ações coordenadas para salvar vidas e manter o SUS operando com eficiência, que está provado que funciona e que é melhor para a população brasileira. Afirmado pelos organismos nacionais e internacionais de direitos humanos. E de gestão de qualidade em saúde. Uma gestão que nega essa gestão que está aí, que é uma gestão federal, enfim, né? Uma gestão que nega, que nega a ciência amplamente comprovada e atua no movimento de desinformação, confundindo e comprometendo a segurança da população. Insiste em um comportamento que ignora todas as orientações e protocolos de segurança sanitários internacionais, promove discursos sem qualquer fundamento científico ou mesmo lógico, reproduzindo argumentos fundamentalistas, racistas, perigosos, o que se traduz num processo de negacionismo total. E nós já vimos isso, a história já nos mostrou, né? E sabemos onde isso vai parar. Então, a adoção da interseccionalidade não apenas revela aquilo que eu já disse, né, os eixos nefastos do colonialismo, ou a atuação de um Estado necropolítico a serviço de determinados povos, os pretos e indígenas, ou originários, como queiramos chamar, mas vai para além disso, né? Ela permite a face cruel, né, de um Estado, por exemplo, que em plena pandemia atua com ações perversas. Vou destacar uma delas, por exemplo, né, em que faz uma ação policial dentro de uma comunidade periférica, que a gente no Brasil chama de favela, e que 78 balas atravessam o corpo de uma criança que estava brincando dentro de casa. Imaginem 78 balas atravessar o corpo de uma criança numa operação policial dentro de uma comunidade onde moram pessoas. Em plena pandemia. Mas mata não só a criança, mata também a sua mãe. E a sua mãe é uma mulher negra. Essa mulher que é negra, ela morre todos os dias da dor, da perda do seu filho, que estava em casa brincando. Então, a casa não é um lugar seguro. Então, essa pandemia, ela mata as pessoas, né? Porque o Estado não consegue proteger, distribuindo a vacina que já existe. Ela mata as pessoas porque o Estado não consegue coordenar ações de protocolos de biossegurança. Ela mata as pessoas porque o Estado é um Estado necropolítico que decide, então, quem pode viver ou morrer. Mas ela também mata as pessoas porque imagina um corpo de uma criança que teve seu corpo perfurado por 78 balas. Qual é o corpo que será enterrado? E ela mata essa mãe por outros motivos. Ela não oferece um serviço de saúde mental para essa mãe. E o Estado não pede desculpas pelo que fez, porque foi o Estado quem matou essa criança. E essa criança, ela não é vista como uma criança, ela é vista apenas como um preto pequeno. Então, essa mãe, ela todos os dias morre por um Estado que tem uma política que, no seu processo de formulação, não leva em consideração um eixo interseccional. E aí eu fico pensando, né? Isso podia ser ofertado pelo SUS, que é um dos melhores sistemas de saúde do mundo. Mas para que isso aconteça, é preciso levar em consideração, então, elementos da interseccionalidade. A interseccionalidade, que além de revelar todo esse sistema de opressão cruel, ela também auxilia em dois elementos fundamentais, que as políticas públicas elas serão construídas, formuladas com equidade e com justiça social. A construção do Estado brasileiro, ela deixou de fora, por exemplo, que a sua construção de sociedade, ela foi racista. Então, apesar de toda a sociedade ter sido construída em cima do sangue, do suor e das lágrimas de 2/3 da população, apenas 1/3 da população usufrui de toda a riqueza socialmente produzida, que são as pessoas brancas no Brasil, né? Então, a interseccionalidade é a forma de reparação das políticas com os outros 2/3, que são os povos originários ou indígenas e os povos pretos, sempre no plural, porque os povos eles são múltiplos. E no contexto da pandemia, é pensar que, por exemplo, as escolas públicas, elas estão fechadas. As escolas públicas, elas têm um papel muito importante para a população, de um modo geral, por conta da própria educação em si, mas ela tem um outro elemento fundamental, que é, por exemplo, para as crianças pobres, para as famílias pobres, ela oferece a principal refeição, a principal alimentação daquele dia. E com as escolas públicas fechadas, as crianças não têm a sua principal alimentação garantida. Então, a gente está falando de insegurança alimentar. E alguém pergunta para mim, Elaine, mas as escolas deveriam estar abertas? Eu devolvo uma pergunta. Por que as pessoas não estão vacinadas para uma doença que já se tem vacina? Eu gostaria de que essa pergunta fosse respondida. Essa pergunta eu faço para mim, eu faço para vocês, eu faço para o Estado brasileiro. Porque à medida em que as escolas públicas estão fechadas, as escolas particulares, as escolas privadas, elas estão abertas. E, claro, isso está criando um outro problema à medida que as professoras e os professores estão adoecendo e estão morrendo. E aí eu me despeço, porque o meu horário terminou, com uma poesia, que eu acho que a arte nos salva sempre, né? Eu quero ler uma poesia chamada, do livro 7 Notas sobre o Apocalipse, ou Poemas para o Fim do Mundo, de Elainey Nacimento, que é uma mulher negra brasileira, e ela publicou esse livro em 2017. Parecia que ela estava sabendo o que ia acontecer. Eu quero ler a terceira nota, que se chama Daria uma cicatriz, diz invisível essa ferida. A poesia se chama Talhos, que eu acho que é tudo que está acontecendo com a gente, é o que a gente está fazendo. Aprender a tempestade, soltar seu peso, secar ao sol, rugir trovões. Derramar a tempestade, despir de peso, pairar no sol, cantar trovões. Suceder a tempestade, fluir seu peso, beijar o sol, gozar trovões. Antecipar a tempestade, ruir seu peso, lunar o sol, cuir trovões. E para que nada se desfaça, nos refaça, nos refaça, nos refaça. Eu acho que é isso que nós, mulheres, temos feito. A gente tem se refeito o tempo todo e, através das nossas mãos, a gente conseguiu, em 48 horas, decodificar o genoma do SARS-CoV-2 e possibilitar a construção da vacina, que é a resposta para a Covid-19. Então, antes de tudo, parabéns para nós, mulheres, porque nós podemos muito. Muito obrigada.
Muito obrigada, Elaine. That was beautiful and powerful, both in terms of how you ended, but also the content of what you were saying up to that point. It was a really important contribution. Thank you. I'm going to turn now to our fourth presentation, which is from Mr. Eduardo Stranz, who is a business administrator. He has experience in public finance with an emphasis on municipal finance, and he has worked for more than 25 years in municipal associations as a manager of technical studies, research, data, and other indicators. He's also a consultant in municipal entities, state secretaries, and city. Over to you, Eduardo.
Muito boa tarde a todos, a todas, né? Quero aqui primeiro dar um grande abraço, né? Essa renomada e essas palestras que são extraordinárias, né, com esses nossos professores e professoras. Meu nome é Eduardo, estou representando o presidente da Confederação Nacional de Municípios aqui do Brasil, né, neste prestigiado evento, e gostaria aqui de aproveitar este momento para falar algumas questões sob o ponto de vista dos municípios, né? Sob o ponto de vista do poder local. Eu acho que um evento como este, né, pode abordar as questões sob vários ângulos, e o ângulo, né, que eu represento aqui é o ângulo do poder, né, e do poder local dos prefeitos e prefeitas do Brasil inteiro. Então, como já foi falado, mas é bom reforçar, o Brasil é um continente, né? Nós somos 27 estados, né? um poder da União, né? Um governo federal, 27 governos estaduais e 5.038 municípios, né? Municípios, e na nossa República Federativa do Brasil, o Brasil é um dos únicos estados, né, países onde o ente município é um ente federado, é um ente autônomo, né, e que tem, né, então, a sua própria autonomia na gestão das suas responsabilidades, né? A partir, então, da pandemia, né, em março do ano passado, março de 2020, quando foi decretado o estado de calamidade, são fenômenos bastante interessantes que a gente gostaria aqui de relatar a vocês, né? Em fevereiro, aqui no Brasil, né, começou a chegar as notícias da transmissão, da infecção do Covid, e a partir disso, né, sobretudo o problema na Itália, e os gestores locais aqui no Brasil tiveram um momento que a professora Andreza comentou ali, um momento de uma quase unanimidade, né, na questão do enfrentamento do vírus. Então, no mês de março, a grande quantidade dos municípios brasileiros adotaram medidas de isolamento social e medidas não foram acontecidas nesses municípios, e na quase totalidade deles, não havia ainda infecção do Covid-19. Né? Estava ainda muito a infecção e a contaminação nas grandes cidades, nas capitais, nas regiões metropolitanas. Mas devido, né, a toda a informação que foi chegando, os municípios e os prefeitos e prefeitas daquela época começaram a tomar medidas de tentativa, né, de segurar o problema da infecção nas suas cidades. Passado 1, 2, 3 semanas, né, com o fechamento medidas de distanciamento e sem nenhuma infecção, a contestar o porquê deste fechamento dessas atitudes, né? Que são atitudes impopulares. Né? Então, você havia no Brasil um movimento no começo de março, onde todo mundo estava indo para o mesmo lado, e que depois de 2, 3, 4 semanas, isso começou a ter uma pressão da área econômica de cada local, né? Os comerciantes, os industriais, os pessoal do agronegócio começou a forçar a abertura daquela cidade, e aí aquilo que a professora Andreza apresentou, a falta dessa coordenação entre a infecção do Covid e as medidas que foram adotadas. E a partir de abril do ano passado, aí sim a gente perdeu completamente qualquer tipo de coordenação dessas atitudes, né? Conforme também a professora Lorena apresentou, né, alguns estados começaram a adotar medidas né, ou protocolos de abertura e fechamento das suas questões todas econômicas, né, pela infecção do vírus, mas cada estado começou a adotar isso de uma maneira trazendo, né, para a sua realidade estadual. E os municípios, né, também atendiam ou estavam sob esse guarda-chuva da questão do Estado e iam aos poucos, né, se adequando. E a partir disso, né, também começou a haver uma interferência, eu acho que aí a professora Lorena foi bastante feliz, uma interferência do governo federal para não que o Brasil não adotasse essas medidas de isolamento social, as medidas não farmacológicas. Com isto, os gestores locais, né, cada município do país, ou nenhum.
Edu, desculpa eu te interromper, eu tô achando que o sinal da sua internet tá bem ruim, tá cortando bastante. Eu não sei se teria como você arrumar isso, ou de repente falar até um pouco sem o vídeo. Eu acho até que ele caiu nesse momento. Você tá aí, Edu?
Voltei.
A gente parou de te ouvir quando você fala da intervenção da professora Lorena na questão dos
Sim.
estados. Se eu pudesse retomar daí.
Então, retomando, desculpem aí, então, assim, quando você teve em cada estado da federação um protocolo diferente, né, os municípios, né, os prefeitos e prefeitas, os secretários de saúde, né, e todo o aparato governamental a nível local, né, começou a atender, né, esses requisitos estaduais. Importante também a gente.
Desculpa interromper também. Eu acho que a sugestão da Andreza pode ser boa, tentar desligar a câmera para ver se a conexão melhora um pouco, se tem como fazer isso. Não sei se você está me ouvindo, Eduardo. Talvez não. Oi, Eduardo, está me ouvindo? Talvez você pode tentar desligar a câmera para ver se funciona melhor. Acho que caiu, né? Novamente. Vamos esperar um pouco para ver se ele volte. Essas coisas acontecem, né, no evento online, então... Se ele não conseguir voltar, talvez podemos passar já nos seus comentários, Ana, né? Podemos esperar um minuto para ver se o Eduardo consegue voltar.
Oi, Eduardo, acho que a gente consegue ver que você voltou para a ligação. Você consegue me ouvir? Você quer pegar algumas questões?
Agora
Acho
voltei
que
bem.
voltou.
Agora deu certo. Botei o 4G aqui, agora não vai dar certo.
A gente está ouvindo bem agora, vamos ver.
Perdão.
Não
Bom,
tem problema.
retomando aqui, com essa, então, divisão para os estados, cada estado tomando seus critérios, alguns adotaram políticas de bandeiras, né, levando uma série de indicadores, os municípios também começaram a adotar estas regras, né, ou tentaram seguir o que os estados estavam determinando, o que seus governadores estavam determinando. Mas houve, né, por parte do governo federal, um grande discurso de desconstrução dessas medidas, né? Então você havia aqui no Brasil, a partir aí de maio, junho do ano passado, uma grande, né, um momento, né, onde o governo federal entendia que a economia precisava andar e que não era necessário fazer as políticas de distanciamento e assim por diante. Então você estava numa relação um pouco complexa, né? E isto vindo de uma federação onde você tem um sistema único de saúde, onde você tem uma hierarquia e responsabilidades de cada um dos três entes, né? Você teve então uma completa desorganização de todo o sistema. Então, desde o menor município do Brasil, que tem 1.200 pessoas, até São Paulo, que tem 14 milhões de pessoas, cada gestor local teve que tentar, da sua maneira, fazer as ações que ele julgava necessárias para que as pessoas não se infectassem e, ao mesmo momento, para que a economia andasse. Então, você teve aqui no Brasil uma dualidade que foi criada de economia versus saúde, né? Uma disputa que não era uma questão uma contra a outra, né? Deveria ser uma junto à outra, aliada à outra, né? Então, ou você teve este problema aqui relacionado, e mais um ingrediente que eu acho que é importante a gente ressaltar, é que dentro desse contexto todo, este era o último ano de mandato dos prefeitos. Então, os prefeitos e as prefeitas estavam se encaminhando para o final da sua gestão, né? Cada gestor tem a sua ambição política, ou quer se reeleger, ou quer, né, fazer o que o seu partido continue no poder, e dentro dessa desorganização total, ele teve que tomar atitudes que eram bastante impopulares, né? Então, foi bastante complexo, né, do ponto de vista do gestor tomar todas essas atitudes, né? E, ao mesmo tempo, o que a gente conseguiu apurar dentro desse contexto aqui pela Confederação Nacional de Municípios é que os gestores foram rápidos na tomada de decisão, né? Embora hoje, né, a gente olhando para o ano passado, a gente possa julgar que as atitudes que eles tomaram foram erradas, eles tomaram a decisão porque precisavam ser rápidos, né? Há uma grande crítica, né, da sociedade para o poder público, porque o poder público é muito lento, né, nas suas interações, nas suas intervenções. E na pandemia isso não aconteceu, né? Rapidamente os prefeitos fecharam, rapidamente eles abriram, rapidamente eles ficaram fechando e abrindo, né? E dentro desse contexto meio caótico, né, que virou a República do Brasil hoje em dia, né? Você não há mais a coordenação do Ministério da Saúde, que sempre foi feita, né, apresentando a política, apresentando os requisitos, né, a interação com o Estado e a execução por parte dos municípios, isso tudo ficou, né, desagregado, descoordenado, e coube a cada um tentar resolver isso do seu problema. Então, o trabalho que a equipe de Oxford apresentou, né, um paper, mostrando essa descoordenação, é exatamente o que aconteceu no Brasil neste último ano, e o que Outras questões assim que também tem que ser ressaltadas é que, devido à pandemia, né, houve uma série de auxílios, como auxílio emergencial às pessoas, houve também repasse de recursos especiais para a área da saúde, extraordinários para a área da saúde, houve recomposição de receitas, porque caiu, né, a economia como um todo, mas o governo brasileiro e o Congresso Nacional, ele colocou uma data para a finalização da pandemia para 31 de dezembro de 2020. Né? Todos os auxílios e todas as questões que foram feitas para a pandemia, elas se extinguiram dia 31 de dezembro, como se virasse o ano e as coisas voltassem ao normal magicamente. Né? Então, você teve, dentro desse caos todo, uma eleição municipal, né? Onde então foram eleitos agora novos prefeitos, novos secretários de saúde, novas equipes na área da saúde, na área da educação, que assumiram as suas prefeituras a partir de janeiro deste ano, sem mais nenhum auxílio, e com a quantidade de casos de infecção aumentando ainda mais. Né? Então, a situação que a gente percebia ser bem caótica o ano passado, está muito pior agora. Né? Eu acho que é uma lição, pelo menos é uma discussão que a gente tem que ter, é que passado este um ano, parece que o Brasil não aprendeu nada, né? Porque nós estamos de novo, né, numa nova onda de abertura de toda a economia, precisamos abrir tudo, precisamos gerar renda, precisamos gerar emprego, e ao mesmo tempo, né, uma quantidade de mortes diárias aí na casa dos 3 mil pessoas, mais de 450 mil óbitos, e isso só aumentando, né, a quantidade de infectados cada vez maior, né, um colapso de todas as nossas UTIs, filas, né, para as pessoas serem atendidas na UTI, e falta de oxigênio nos hospitais, falta de kit de intubação, falta de tudo, né? E nós estamos andando no meio disso como se nós estivéssemos meio que no escuro, tateando as questões. Então, o problema, eu acho que é um problema muito maior do que a gente possa entender, né? E também não é um problema de quem é o culpado para isto, né? Eu acho que todos são culpados e todos teríamos que se unir como sociedade e tentar achar um caminho, né? A previsão que a gente tem aqui, vinda os relatos dos prefeitos atuais, por exemplo, estava agora há pouco, antes de entrar na reunião, um prefeito no interior do Pernambuco disse que semana retrasada ele tinha 10 casos e essa semana ele tem 400 casos. Então, como é que ele vai... Não há poder público que consiga fazer frente a um aumento dessa magnitude. Né? Então, eu acho muito interessante, né, um evento como esse para discutir essas várias visões, né, sobre o problema, mas o problema também governamental é um problema grave, porque há uma desconstrução da nossa república. Né? A nossa Federação Brasileira, infelizmente, está, né, sofrendo uma desconstrução como, né, a grande maioria das coisas aqui no Brasil. Eu acho que eu cumpri meu tempo aqui, quero pedir desculpas aí por ter caído na minha fala.
Thank you, Eduardo. I would like to ask Anna to make comments or questions to the speakers, and then perhaps if we have a few minutes to take some questions from the audience.
Well, thank you, Katerina, and thank you, Eduardo. That was really, I think, valuable to have the perspective from someone who really knows what is talking to mayors and city councillors all the time. I will keep my comments quite brief because I would really like to bring in some questions from those listening on the call. In listening to the themes that have come out of the presentations, I think there were three things that I really want to highlight and that might be quite helpful for framing the rest of the discussion. I think the first one is really to think about the pandemic in Brazil in terms of stages over time. The second one is really to reflect, I think, proactively, positively on what we can do henceforth about issues of coordination and coherence that have been really problematic in Brazil's response to the pandemic. And I think the third one, again, emphasizing sort of the public-facing positive spirit that is featured in so many of these presentations, is really to also both acknowledge the problems of inequality that have made the pandemic so bad in Brazil, but to think about how we can, at this point on, cut through some of the mechanisms by which the existing inequalities are likely to be exaggerated and deepened from this over the years to come because of the pandemic so far. So just on the stages over time, Andreza, I found your numbers quite stunning about how quickly the municipalities moved in terms of bringing in quite strong policies. And I find that very interesting, and we see that in the tracker data across the world, that countries, as well as Brazilian municipalities and states, implemented lockdowns not when the WHO advised them to, and the advice was to do it in relation to the strength of local transmission, but from the moment the pandemic was announced. And this goes to the gap that Eduardo was talking about and the accelerating death rates that Lorena was talking about, in the sense that so many subnational jurisdictions went so early with really tough rules that these were really unsustainable. They were released quite early. And I think going so tough so early meant that it was harder to implement tough lockdowns in the second wave and the third wave. And then the second point was coordination and coherence. And Eduardo, I thought you spoke really impactfully about issues of vertical coordination failures, as well as the horizontal failures that were so evident in Andreza's maps. And I think one of the ways in which I'd like to pull together some of the thoughts that have been expressed is in saying, well, how do we try and improve things from here? So, Andreza, a question for you is really, is there a way of tapping into the activism from below in trying to solve some of the problems of coordination and coherence, and some of the issues, correcting some of the messaging issues that Lorena was picking up? And I think that's also a question actually for Elainey. I would really like to get a perspective on that. What can we really do with Brazil's fantastic instinct, I think, from activism from below, and space that the country does give for participation in local policy making? How do we invigorate that at this point? And then the third theme, really to think about how do we prevent deepening injustice based on the structural inequalities that exist in Brazil and that have been already worsened by the pandemic. I think we need to, as a community of thinkers, as academics, know what the right questions to ask. What should we be monitoring at this point? I was in a panel about education recently, and one of the other speakers showed data from earthquakes. And earthquakes are really what we have to go on in understanding the long-term impacts of education, because you have a group of people in a country who've had to study at home and the same cohort going to school. And what we know is that 4 months of missed education adds up over time, if you like, from the years that we are at now in the years to come until kids that have missed education today will graduate. 4 months cumulatively adds up into 2 years of missed schooling, because the system doesn't know how to respond to such a range of educational levels when kids come back from school. So how do we think about what are the right questions to ask as academics trying to do work that is going to be of benefit to policymakers? And I think this is a question to ask not only of education, but also to think about what can we do that is of value to making the SUS even more robust. So I think those questions are probably best posed to Lorena and Eduardo. So just to repeat, so Andreza and Elaine, it'd be wonderful to get your reflections on what we can do to tap into Brazil's spirit of activism from below, to deal with issues of coordination and coherence. And Lorena and Eduardo, what are the questions that we should be asking to help public policy makers prevent deepening inequality from this point on? Thank you. And I'm going to hand over, Andreza, would you like to go first, actually?
Yes, thank you, Anna, for your comments. I'll try to be brief. To begin, I think, as I mentioned in my talk, that poverty is an enormous form of political oppression. So we rely on activism from below, and they have been first responders, but overburdened by diverse situations. So I think what is important here is to really think how these communities have still mobilized, despite what Elaine said, that a lot of them have been going to work, they have been in vulnerable situations. And how can we then have them still mobilize? How can the state support this mobilization from below? And especially when we think in a situation that the state is also a form of political oppression for many of those groups. So we end up in a situation that is who is going to protect these groups, you know, so that they can mobilize if they're so vulnerable. And one of the answers I have been thinking about to get out of this dilemma is in ways of using this community intelligence to use the data that is coming from communities and to really learn from them and to hear the main strategies that they're doing. So we have been trying to invite them for talks like these ones and emphasize what is being done to strengthen, to give more voice, to give more of a stage, so that actions like this, they gain importance and they gain an audience and they can be multiplied by other groups and other communities and other strategies and so on. So I think this could be a way to answer your question. And just to briefly tap to Roxana Cavalcante's question on Q&A, which is how academics can start to learn from the pandemic for a post-pandemic response, for a post-pandemic world. I think my answer to that is really to think of studies that also very localized, think that the pandemic was very different across Brazil, but also very different over time. As Eduardo said, 1 week, 4 cases or 10 cases, and then the other week, 400 cases, sorry, I forgot the numbers, but the epidemiology of the pandemic has been so fragmented as well as the actions. So I'd say that we really need to map the cities very well to study them in the future. And remember, and that complementing the answer to Anna's question, remember to really look beyond the main data that we gain from governments, but also look at other sources of information that have contradicted some of the official data, saying number of cases and contact and trace that is being done through other groups in these communities where the numbers and the state, as well as our knowledge, quite cannot reach. Thank you.
Thank you, Andreza. Elainey, I was wondering if you had some thoughts on how do we foster activism in the way to really correct some of the issues of participation and this.
Aqui tem. Eu queria falar 2 coisas que eu acho importantíssimas. Uma delas é que eu trabalho numa instituição fantástica, importantíssima, centenária, chamada Fundação Oswaldo Cruz, a Fiocruz. Não só porque ela é responsável por construir a vacina e que, enfim, está chegando a todas as brasileiras e brasileiros, mas porque a Fiocruz, ela está completando 121 anos, e pela primeira vez ela tem uma mulher à frente, né, da instituição. Mas porque a Fiocruz, ela, no ano passado, no início da pandemia, ela fez uma coisa muito interessante. Ela conseguiu organizar um recurso e ela construiu um edital e ela ouviu a comunidade. Em relação à primeira pergunta, né? Ela ouviu a comunidade e esse edital era pensar como as comunidades podiam reagir muito mais rapidamente do que o Estado, né? Pensava numa forma de se ajudar para responder às necessidades mais básicas em pleno temor e vapor da pandemia. Então, esse recurso fez com que quase 95% dele fosse resposta de mulheres atuando dentro das comunidades. Esse recurso foi por 6 ou 3 meses, financiando ações coletivas ou comunitárias de mulheres dentro da sua comunidade. Isso fez toda a diferença. Isso salvou vidas quando o Estado ainda estava se organizando. Isso, então, foi uma instituição pública se mobilizando para chegar antes de qualquer outra instituição. Então, isso foi uma coisa muito interessante. A outra coisa que eu acho que associa o ativismo com a academia, com a ciência, é que também a Fiocruz é uma instituição não só de renome, mas ela reúne, né? E reúne o que se tem de melhor em termos de ciência na área da saúde, porque ela articula esse campo de pesquisa com o campo de conhecimento das universidades. Então, quando a gente produz conhecimento, a gente está articulando com outras instituições de ensino e pesquisa e extensão também. Extensão é quando você está na academia e pode articular com quem está nos movimentos sociais, ou com quem está nos serviços, ou com quem está nas comunidades. Isso faz toda a diferença. Então, é produzir conhecimento e aplicando na realidade social. E eu acho que a gente faz muito bem isso. Acho que a gente precisa fazer mais. Não digo, não necessariamente a Fiocruz, outras instituições. Então, possivelmente, em tempo real, você identificar o problema e conseguir aplicar uma solução prática a esse problema. Isso só é possível quando a gente produz informação, né? Produz dados. Esses dados precisam ser confiáveis. Isso tem tudo a ver com ética em fazer pesquisa, né? Mas aplicá-la a uma realidade para mudar a vida das pessoas. Eu acho que a gente tem feito isso. Eu acho que era mais ou menos isso que eu queria falar.
I cannot hear Anna. I don't know if it's just me or nobody can. But your microphone seems to be on. I don't know why. But perhaps I guess Lorena can answer the question that Anna has asked before, and then Eduardo.
Yes. Okay. So I think it's really important to talk first that I'm speaking as an academic, but also someone who has chosen I understand the difficulty and I respect the difficulty. We live in a developing country in a pandemic, and there's tremendous limitation of resources. But I think as academics, I see our role as really being an independent voice to dialogue, encourage discussions with policymakers about how we can be improving the response. And that means that we have an ethical responsibility when we see that policies are failing, that lives are being exposed, infections and deaths are occurring that could be avoided. I think we have an ethical responsibility to be active in the debate, help to produce data, to mobilize society and mobilize policymakers and also to really communicate more carefully the risks. A lot of what has happened in COVID is it's been so politicized, but we have to remember, like Andreza and Elainey were talking so much, how much the daily life of individuals is, do I go to work? Do I take a bus? And to understand, should I take that medication? Should I really take this vaccine? Those are very difficult individual decisions that each person in Brazil is right now being forced to make. And I think we have to really, as a society, encourage that public policies be made to protect the most vulnerable and to think about the most vulnerable and to really prioritize those communities, because we know that the impact of COVID is unequal, and we know that the long-term consequences of COVID are also unequal. The children who last year lost a year of education that will never be made up as easily. We need to be signaling and mapping and measuring inequalities, not just because it's important to signal what failed, but also because if we measure better and we document what's not working, we can actually start to try to target about the difficulties and the difficult government policies that need to be designed to address those specific problems and to start to try to be a small step in the right direction. And I think just in terms of thinking about, we're all very cognizant and I think we're all invested in, the same situation in the same society and the same problems that led us to start the pandemic, we are at a moment where we need to revisit and we need to reinvigorate our commitment that we leave this tragic moment starting to build a different society and a more resilient society for the future. And I think we need to think about that, and it can't start without addressing inequality, and it can't start without also including more nuances about science in public policy decision-making in Brazil. And that includes underscoring uncertainty. As Andreza was really inspired in calling the attention to this panel. This panel is underscoring uncertainty. A key and a really big challenge in Brazil in this moment is any policymaker who's making policies is making policies in a very highly uncertain and highly volatile environment. But the uncertainty is really important to incorporating into decision-making at the citizen level and at the government level. And we need to be thinking about, what if you're wrong? The risk is how many more lives are going to be lost by making this decision. And I see that our work and what we're really trying to do is, as an independent voice as academics, raise some of those questions that I know are really hard, but we're doing it in the spirit of an ethical obligation to try to protect vulnerable populations.
Eduardo, if you would like to make some final considerations, and I think then our time is up, unfortunately.
Só, então, gostaria de agradecer, né, mais uma vez, e eu acho que um pouco o resumo, né, de tanto que a professora Lorena, a professora Andreza, quanto a Elaine falaram, é que, embora a gente aqui represente o poder, né, o poder local, os políticos, né, a sociedade deve sempre, né, deve sempre perseguir sempre a obtenção do poder político, né? Então, as comunidades, as injustiças, as desigualdades, essas né, comunidades, esses líderes de base devem procurar um espaço, né, para fazer a gerência política, né, da sua cidade, do seu local, do seu bairro. Eu acho que só desta maneira que vai se conseguir mudar a realidade que se apresenta, né? Não podemos ficar naquela que deixe eles lá e eu aqui, né? Nós temos que, de alguma maneira, interferir nesse processo todo para que a mudança ocorra, né? Então, eu acho que esta é uma questão que fica, né, deste brilhante seminário, e colocar aí a Confederação Nacional de Municípios à disposição de todos. A gente está produzindo muita informação, nós somos uma entidade, a única no Brasil, que desde março do ano passado está realizando pesquisas bastante aprofundadas, com informações de mais de 4.500 municípios. Nós temos aí um panorama de tudo que aconteceu em cada cidade brasileira, como é que isso se deu, como é que se deu todas essas questões. Estamos fazendo também pesquisas semanais, né, mostrando os problemas de hoje, e estamos aí, né, temos um acordo de cooperação com a Universidade de Oxford, através do departamento da professora Andreza, onde estamos produzindo alguns estudos em conjunto, mas queremos, né, e temos todo o interesse que cada vez mais a sociedade saiba o que acontece na sua cidade e como é que funciona, né, a nossa república e as responsabilidades de cada um dos níveis de governamentais. Então, quero agradecer novamente aí e nos colocar à disposição.
Thank you so much, Eduardo. Thank you, Lorena. Thank you, Elaine. Thank you, Andreza. And thank you, Anna. This has been a fascinating debate on such a complex and urgent issue, like responses to an ongoing pandemic. Sadly, our time is up, so we need to close the session now. But I would like to invite you to come back next Wednesday at the same time and participate in our final panel session titled Brazil's Populist Authoritarian Grip, What is at Stake for Brazilian Democracy? The closing address given by Supreme Court Justice Luis Fux will be released shortly after.
Yes, I just want to thank you, everyone, and also highlight that next week, the panelists will be Isabella Calil, Esther Solano, Marcos Nobre, and our own Caterina, who will be presenting. And if you want to follow us to also get the link for this presentation, as well as any other information, we are on Twitter at Oxford BSP. And thank you so much for being here with us, and see you next week, hopefully.